Hi, I'm Dr. Raghu Athre with Athre Facial Plastics in Houston, Texas. I'm a double board certified facial plastic surgeon, and the main nuts and bolts of my practice is facial rejuvenation. One of the procedures that's kind of the workhorse of my practice is fat transfer. I use it in almost every facial rejuvenation procedure that I do, and hence I make a lot of videos about it. If you make a lot of videos, you get a lot of questions. So let's chit-chat a little bit more about fat, specifically the regenerative potential of fat. I have alluded to the fact that in many of my fat transfer videos, I like fat not only for the volume transfer component, but there is this regenerative potential. What does that mean? Let's take a little break. Your body has the capacity to regenerate and fix itself. You've probably heard a lot of hullabaloo about things like stem cells and PRP and all these things, and there's a lot of science now that basically shows that there are components within the body that are geared towards the body fixing itself. Okay, this is being used in, for example, knees, and they're injecting PRP in knee. They're doing these type of things for back pain patients and shoulder pain. I actually had a problem with my elbow playing tennis, and my hand surgeon said one of the protocols for management of this is injection of PRP into the elbow. So this is becoming mainstream as part of medicine. Now, one of the cool things about when we do fat transfer, and I'm putting that in a very specific box because all fat transfer is not the same. So when we do fat transfer to the face, which is a very specific category of fat transfer, we are harvesting fat cells with a very small cannula. So the fat molecules that are being harvested, or the stuff that's being harvested, has a little bit of blood, some fat cells, some stromal cells, which is the stuff around the fat, as well as some fatty acids. Now we spin that stuff down in a centrifuge and take off the blood, and we take off the oil component to be left solely with the fat cells and the stromal component, okay? Now the fat cell plus stromal component is then passed through several sizers, from large all the way down to small. The larger sizers have a larger percentage of fat cells. The smaller sizes, as you get down the pike, you're having less fat cells, a little bit more stromal tissue. And you're going, but I want the fat for the volume. Here's where the magic happens. When you get to a certain point and you get past that point of sizing, and we use micron filters, you're basically taking out all of fat cellular components, leaving the stromal fraction as well as stem cells, which are so small that they can pass through the little micron filter. That specific thing has a misnomer. It's called nano fat. That's what that product is called, but it's not really fat. It is the stromal component with the regenerative cells that came from the fat. When you inject that stuff, magic happens. It has a high incidence of growth factors and all this kinds of stuff that allow tissues to repair themselves. So for example, this can be used for acne scarring. You can inject that component into the acne scar to help the tissues repair themselves. It can be used for burn scars. It's been used for patients that have large surface area burns with contractures to help break down that tissue. In a cosmetic standpoint, it can be used for little fine lines because it's helping that tissue regrow its collagen and elastin. These are all the super cool stuff that you get as an oh by the way when you do fat transfer. You do not get this whole category of regenerative potential using hyaluronic acid fillers. So this is one of the main reasons that I really like to use fat transfer in all of my facial rejuvenation procedures. So one is for volume. Yes, that's a key critical component to be able to rejuvenate that volume. But the second aspect of this is the regenerative potential in healing these tissues. So my patients know that their facelift, yes, they like the result when they see it at 3 months and 6 months, so forth, but that's just the tip of the iceberg. Their face is going to continue healing itself and rebuilding collagen and elastin, and the results keep getting better for 6 months, 9 months, 1 year after surgery. So this is kind of super cool to me, and I find this kind of the next big thing in science, especially in health. So I hope you found this video interesting, and you can clearly see that this is a topic that's near and dear to my heart, that I love learning more about and working more in terms of being able to regenerate my patients' natural tissues. If you found this video helpful and interesting, please go ahead and hit the subscribe button, give me the thumbs up. If you have questions, get a hold of us. You can DM us, email us, send us comments. We appreciate them. Till next time, I'm Dr. Raghu Athre, Athre Facial Plastics, Houston, Texas.